A very good afternoon to you, sir, and thank you very much for joining us. When we look at the 15 countries in the region, Ghana leads in terms of the number of infections that the country has. We also understand that President Nana Akufo-Addo has gone into self-isolation. What can you tell us about that?
That is a published information. Thank you very much for having me, by the way. It's good to speak to you from the southern part of our continent. And that is a published information that is in the public domain. And I think it's fantastic because it shows that the head of state is leading by example. He takes it seriously. If there is ever any concern that people around him may have come in contact with COVID-19, in the abundance of caution, he decided that he would self-isolate. And that is fantastic. That is what we expect to see, where politicians and our leaders are following the public health advice. And so we hope that after the 14 days isolation, he will be tested and he will be negative and he will never contract it. But he is doing the right thing.
The West African region sits at 88,453 confirmed infections across the region. In terms of testing capacity and tracing, are you satisfied that enough is being done? Yes.
At the moment, we are testing as much as we can, and most of our countries are doing extremely well. As you said before, Ghana has done about 290-something tests, but 1,000 tests. But remember, those are primary tests. Overall, in our region, we've done about 780-something thousand tests, but those are primary tests in 15 countries. What we find is that initially, during the evolution of this COVID-19, in terms of loss of contacts, we were having up to some countries having up to 10% loss of contact, but that has gone down now, and we don't have any country that has more than 1 to 2% attrition rate in terms of contacts. So they are picking up on the contacts following the testing. The third thing is that as Africa, we had put a target of 1% of our population being tested by the end of June. Unfortunately, we are not able to meet that in any part of Africa. Of course, South Africa is doing extremely well and has almost met that, also Ghana. But the average is that we are on about 0.4, 0.5%. We are not up to that 3.8 million that we need to do if we are looking at 1% of West Africa. So that's why we are ramping up testing. Some of the increase in cases is because of ramping up of testing. Across our regions, we are now deploying some other platforms like GeneXpert, but in addition, some countries are bringing in random diagnostic tests as a screening method before they then do the PCR. So we are very positive that we are on the right track, and the increase in cases, some of it may be due to increase, but a lot of it is due to increase in testing.
Nigeria is also a country that is seeing high numbers and has also got a number of issues that has been plaguing the country even before the coronavirus actually came to play. You had a meeting with President Muhammadu Buhari. What did we hear from that?
It was really to update him on the issues of what ECOWAS, the Economic Community of West African States, of which WAHO, the West Africa Health Organization, is the health institution, to update him on what we have been doing since the summit of the heads of state of ECOWAS on the 23rd of April. And we were tasked to continue to lead the regional response and to present him with what we have done, to present him with the issues of coordination, issues of communication and collaboration that is led by WAHO, the goods that we have procured to distribute to member states, the training that we have laid on, the advisory, and then also the preparations for opening our borders, because we have 3 ministerial coordinating committees that are meeting both separately and together to coordinate a regional approach to easing the lockdown. And it was also helpful that the champion, President Muhammadu Buhari, was able to and was gracious to also offer us fantastic logistic support. So WAHO now has a distribution hub in Abuja, and WAHO has also received logistic support in terms of transport that is helping us reach the other 14 member states of ECOWAS.
Nigeria is one of the countries where nurses have gone on strike because of a lack of personal protective equipment, amongst other things. What is it that is being done to make sure that these critical workers are also protected?
You are really correct that it's important to look at our health care workers, because it's not only the fact that we do have problems with capacity in terms of not having enough health workers, and therefore we are using a surge regarding volunteers. It's also important that we create the conditions to retain those that are there and also protect them from COVID-19. So Nigeria, for one, and all our countries, there's none of our countries that is not looking at this and that's not doing that. Nigeria has instituted hazard allowance payment in terms of improving the conditions of service of the health workers. They are absolutely determined in terms of PPE. I'm aware, because we're using now the same warehouse, that a lot of PPEs have been procured by the government, and we also procured a lot of PPEs, which we are PPEs, personal protection equipment, which we are targeting to the health workers. But do remember that Nigeria is such a vast country with 36 different states that have capacity and constitutional responsibility for running health programs. So it is part of the issues that there may be, and I know that talks are ongoing between the Minister of Health and the Minister of Labor and the striking workers. So we hope that it will be resolved, and we plead as ECOWAS that it is resolved quickly.
Professor Okolo, thank you very much for your time.